Hello everyone, I'm here today to present the October team brief, and to try to make the communication as effective as possible, I'm filming today in the boardroom with adequate and appropriate social distancing in place and all of the boardroom windows open so that the room is fully ventilated. Measures that I know we're all familiar with now and that we're all trying to use. Clearly COVID-19 is going to be a significant feature of today's brief due to the upswing that we've seen in all of our local communities. As of this morning, the 29th of October, we currently have 204 patients in hospital with 10 patients on intensive care. Patients and the intensive care beds are split between both sites. So at the moment at Bassetlaw Hospital we have 20 patients in total with 2 in intensive care, and we also have a number of patients at Mexborough who unfortunately have tested positive for COVID-19. Thankfully the number of patients is beginning to fall at Mexborough, which is a really positive move forward, but we are expecting to see a continued steady rise in admissions to both sites for the next week or two, after which we are hoping that the number of admissions will begin to fall, although possibly not as sharply as they did in wave 1. We clearly are continuing to discharge patients successfully, and treatments in wave 2 do appear to be working much better because of the advancements of areas like remdesivir and dexamethasone, and hopefully that's a positive step forward as well. As of today we've discharged 713 patients. However, sadly 309 have passed away as a result of illnesses either associated to or complicated by COVID-19, and we must pass on our condolences and our respects to the families and friends of those patients. The total number of patients that we've treated so far is 1,226. As I said, we do expect that to rise over the next few days, but then hopefully it will then begin to fall back. And clearly, if the measures are as successful as wave 1, we would expect to see that continue for the weeks and months to come, with some prospect then I think of getting into a position where people can have more of a normal type of Christmas. It has been incredibly challenging as the second wave begins to significantly impact on our services. We have seen the increase in patients, but we've also seen an increase in the number of staff who've been affected by contact tracing, but also infected by COVID-19 illness themselves, and clearly we wish them all a speedy and healthy recovery. But clearly the measures are in place to try to prevent the impacts of COVID-19 inside the hospital and outside the hospital. We do have to manage the hospital in a very different way again now because of the impact on the COVID and the non-COVID beds, and as a result of that we are managing the activity from the emergency and the elective side to make sure that as much as can be done to have the right staff in the right place is being done. We expect to have to continue to do that, but we will review it on a regular basis because we all recognise how important it is to restore those services for the patients who've had longer than expected waits for service, and we want to make sure that those patients get their treatment as quickly as possible. However, at the moment we are concentrating on emergency, urgent and cancer patients, and obviously trying to anticipate any patients who would come into that category if their procedure or treatment was delayed, and making sure that they get the appropriate treatment at the time that is required. To support you all, we have stepped up the management arrangements. There are now senior management team members on site 8 till 8 Monday to Friday, 8 while 6 at the weekends, and exec team is now meeting at least 3 times a week in case there are any more decisions or otherwise that need rapid implementation. Clearly we'll keep that under review, and if exec team is required 5 or 7 days a week, we'll take the action. But hopefully the measures that we took in wave 1 are still effective, and what we're doing now is supplementing those with key decisions to make sure that the services are able to run as well as possible, and that there are no issues with things like PPE that we experienced in wave 1. PPE is a real positive in that across the country we now have 4 months supply of all of the key items. with 75% of those items now manufactured in the UK, which means that we've got much more resilience for the COVID pressures now, but also for any issues that may result and develop as we move to leave the European Union in the new year. The supply chains for things like PPE are much more robust than they were at the start of the pandemic. So hopefully staff will not have to worry and be concerned about PPE running out. Clearly, activity in September is detailed in the written team brief. Suffice to say that we continue to perform well when compared to South Yorkshire and also when compared to the national performance numbers. We were beginning to restore services, and as quickly as possible we'll get back to our recovery plan to do so. The emergency departments were beginning to see the same sorts of numbers as in the pre-COVID years. Clearly those will change a little bit, but the priority remains the same, to make sure that the emergency pathways are robust and resilient, and that the patients that we see and care for there get the right sort of treatment as quickly as we can provide it. That will be enhanced in the coming week by the delivery of point of care testing, and that will allow us to test all admissions from the accident and emergency units to the ward and department areas and have a COVID result within 90 minutes. A positive result is the quickest, but obviously the sample is left to rest for a little longer to confirm that the patient has a negative result. So the total test for a negative result will be about 90 minutes, and these are not high volume machines, but I'm sure that people will agree that knowing the status of a patient on admission allows us to get them into a COVID or a non-COVID bed, and will significantly reduce the issues that we've been experiencing with asymptomatic contacts, and obviously the impact of that for other patients who may have shared a bed bay, for instance. So that, I think, is a really positive step forward. Where we are financially, we move into a new financial regime for months 7 to 12, and the September figures see the end of the top-up payment that we've talked about. If people remember that in months 1 to 6, we were topped up for expenditures to bring us back to a break-even position. So as we move into month 7, the trust is broken even. There was a deficit in month of about £3.1 million, which was made up of costs associated to restoration of elective services and costs indirectly associated to and directly associated to COVID. Moving forward, we have a budget, and the budget is taking account of the money we spent in wave 1 and months 1 to 6, adjusted for the remainder of the year. Clearly, with the second wave upon us, we will have to keep a close eye on the expenditure associated with COVID and non-COVID to make sure that if there is any additional costs, they're identified to the centre so that we can achieve our financial plan, and we will continue to do that through the next period, through the end of the financial year. But clearly our priority at the moment is to make sure we have the services in place to deliver the response to COVID, and we will then resolve the financial issues as part of the ongoing monitoring of expenditure for the remainder of this financial year. We had to make some changes to visiting because it was apparent that there was asymptomatic carriage of COVID in the community, and as a result of that, visitors who didn't know they had the disease and didn't know they had the virus impacting upon them were coming into hospital. So that was a measure that we needed to take to protect the patients who were vulnerable, but also to protect our staff. The other development or piece of news was clearly the government's announcement of the 40 new hospitals. We had been very hopeful that Doncaster would be announced as part of that package. Unfortunately it wasn't, but we remain optimistic that we have a very good proposal, we have a very good bid to put forward for the next wave of 8 elite new hospitals. We have some meetings coming up with very senior staff in the NHS England to discuss next steps and how we might take that forward. But as I said, we remain optimistic, and it does remain one of our goals, one of our strategic goals, to get that funding secured. Next week we have the planned return of maternity services to Bassetlaw Hospital. As everybody knows, we had to take the difficult decision to merge the services at the beginning of wave 1, primarily because of vacancies within the midwifery service. We have had a successful recruitment campaign, and midwifery staffing levels have improved to the point where we believe that we can continue services through winter and through the next stage of the pandemic. But clearly, as with all of these matters, we will keep it under review, because we do need to make sure that the services are not under extreme pressures and that COVID levels are within our planning assumptions. So hopefully next week the services will get off to a great start, and as I said, the patients, the ladies that we serve in the Bassetlaw community, will be able to go to their local trust. But we will keep that situation under review to make sure that the services we provide are as safe as possible. There are some other developments and some good news in terms of the PCR and COVID testing. So I've talked about point of care testing. We, as part of South Yorkshire, are currently working with the Centre, the Department of Health and Social Care, on the deployment of technology which is called LAMP technology, which allows COVID-19 samples to be taken by saliva and allows the number of samples per day to be significantly expanded. We have been allocated 6 machines, which at full automated capacity would mean that we could offer up to 36,000 tests per day in South Yorkshire. Clearly there's some way to go to secure the machines on site and put the right staffing model in place, but we're working hard to do that, because we recognise that a saliva test is much easier for staff, because what we will be able to do with that sort of technology at that sort of volume is offer weekly testing to vulnerable patients, to our staff and to social care staff, so that we are picking up any asymptomatic patients, asymptomatic staff, and doing a significant amount of good in terms of stopping the transmission rates in the communities, particularly to the vulnerable patients. We're hopeful of being able to secure the premises, the site for that, and we're just working out the detail, and we'll update staff as quickly as possible in terms of what the likely time frame would be when that would become available to us. The other positive is that there seems to be an increasing degree of optimism about the availability of a COVID-19 vaccine. The clinical trials appear to be going well, and we are being asked to make preliminary preparations to be able to offer the vaccine to the over 75s and vulnerable patients, and then to all of NHS and social care staff. And we are doing exactly that. We are making preparations to be able to offer COVID-19 vaccines as soon as they become available. The key to one of the vaccines, and the one that appears at the moment the most likely to be available first, is that there has to be a 28-day gap between the influenza vaccine and the first COVID vaccine. And therefore we would like again to encourage everyone, members of staff, our friends and our families, to get the influenza vaccine as quickly as possible for protection against influenza through the phases of winter, but also so that you are in a position, if you choose to do so, to have the COVID vaccine as soon as it becomes available and we're able to administer it. As I said, it's a minimum 28 days, so please think now about getting the influenza vaccine so that you are there and you have the opportunity to have the COVID vaccine as soon as we can make it available to you. In terms of the other things, the staff survey is out now. It would be really, really great if as many people as possible can fill it in, because it's an indicator to us of the sorts of things that we need to work on. There is a section on it about COVID, because clearly we want to learn lessons from the COVID work that we've done to date. But the only way we'll get that information is if as many of you as possible fill that in for us, so we can see what the actual key issues are for the majority of the staff. So please do your best to fill it in. In terms of parking, we've been able to make some progress with Doncaster Council, who I would really like to thank for their flexibility around being able to remove the parking charge notices from the local area. But please park sensibly and with due regard and courtesy to the households that are wrapped around the DRI site. If there are any significant problems with inconsiderate parking, the council would have to reconsider the position. So I think it's a really positive thing for us, and please help us to maintain that for as long as we can by parking considerately. we're intending to reintroduce the free sandwich bags to the ward areas that have got the sorts of difficulties with PPE that we saw in wave 1. We're hopeful that that will start, if not today, Friday, then early next week. And we are also going to provide some temporary dining facilities so that staff who do want to sit down to have a meal can do so with the benefit of adequate and appropriate social distancing. So at Doncaster, we are intending to open the badminton court area next week so that staff have that facility available to them. The key messages, I think, around COVID, it remains that message of please follow the PPE measures inside the hospital, hands, face and space. Please set a good example to your friends and family when you're out of work. And please remember that social distancing images and otherwise are there now and they're there next week and they're there in a month. So if there are posts or images or comments on there, please make sure that they are clearly respecting the measures. So if it's a picture, an old picture, if you can, make sure that people know that, but please make sure that you are following that good guidance, that good practice, because the public are looking to NHS workers to set the example and to set the example of why the measures are important in preventing the spread. So hands, face and space, until the vaccine's available to us and fully effective, is absolutely the best way of stopping the transmission of COVID-19 and influenza and norovirus, and is the key thing for us to do to make sure the pressures within our hospitals are manageable through the next phase and through the winter months. We are making some changes in respect of the ways in advisors, and we're advising all patients and relatives that unless, from the patient's perspective, they're mobile and in bed, they have to wear a mask, and also that no visitors will be allowed into site without a mask. I think in respect of medical exemptions and others, then there is a key decision point that if the person is coming into an area or visiting a site and has a medical exemption, that may be because there's a risk factor, and we therefore need to encourage mask or visor wearing for them as an extra level of safety to make sure that we keep people as safe as possible, including our staff members. We've also been encouraging clearly the correct and appropriate use of our emergency services so that we cut down the risk from social distancing, we cut down the pressure, and again there are alternatives in the community where we're pointing people to rather than attendance at the emergency department, because at the moment we want to make sure that we are able to provide those robust services for the patients who have an emergency or an urgent care need that can't be met in the community. We're implementing, and we would encourage people to regularly risk assess their environment and their health and the factors to make sure that we've got the adequate health and safety support PPE at the right level for colleagues, and also in the environment to make sure that social distancing is in place and is supporting that safety culture around transmission of this virus. We would also encourage people to turn off the app when they're at work, the COVID-19 app, because clearly on contact tracing it becomes very difficult to know where your contact is. So if you're at work, please turn the app off. But if you do get the messages, then please follow the guidance in respect of isolation. It's available on the Hive. You can also find it on the government's website. But if there is any doubt, please ring the sickness helpline. In terms of the advice around working from home, we have issued guidance to managers by which they can discuss this matter with colleagues. Clearly, the first stage and the first step for ourselves as a hospital is to make sure that we've provided all of the support we can to the clinical and the frontline areas, and that is at the moment requiring some redeployment of staff. And thank you for the staff who are getting behind that and actually are being redeployed to areas to support colleagues. It's really, really appreciated. But where colleagues work from home, then obviously we hope that the guide will allow those decisions to be taken quickly and to recognise the key pressures in respect of work that doesn't need to continue but can be safely done at home with supporting colleagues in the clinical areas. And again, if you want some information on that, it's on the Hive. You just go to the items under W and you'll be able to see what the guidance is. Any questions staff have got, we've updated the Q&A on the Hive so that hopefully all the regularly and frequently asked questions are there with the appropriate answer. But clearly if we've missed something, if we let the comms team know, we can hopefully provide an answer on there that should be there under Q. If not, let us know and through comms or other means, and we'll try and make sure that the update is there for staff to be able to refer to. So thank you very much for taking the time to listen to me. As I said, please set the example around management of COVID-19, but above all, please stay safe, yourselves and your families. Take care.